Hi, I'm Megan. I'm going to be your nurse today. I am going to do an exam on your cranial nerves, and we're going to do cranial nerves 2 through 12. Is that okay?
Mm-hmm.
Perfect. We would start with number 1, but number 1 is your olfactory nerve, and we're not testing that today, but that is your sense of smell.
Okay.
So we're going to start with cranial nerve number 2, which is your optic nerve, okay?
Okay.
So what I'm going to have you do is I'm going to have you, we would normally do a Snellen chart, but we're not going to do that today, but I'm going to explain what we would do in the Snellen chart, okay? So for the Snellen chart, I would have you stand up, and then I would have you cover your right eye, then your left eye, and then both eyes would be open. And I would have you read a chart that's good, would be down a hallway, it's about 20 feet, I'd have you stand back, and I would have you read the lowest line that you possibly can. And depending on how, if you didn't miss 3 or more, then that would be what your vision would be, okay? Do you wear any glasses?
I do not.
Okay, if you did wear glasses, we would keep your glasses on for your Snellen chart exam, and then we would take them off as well. So we're gonna do, and that does for visual acuity, so we're going to test your visual fields. So what I'm gonna have you do is I'm gonna have you cover one of your eyes, and then I'm gonna have you tell me what you see, what number you see, okay?
Okay.
Go ahead and cover your right eye. Perfect.
Line. 3. 2.
Perfect. Now we're gonna do the other eye.
Line. 3. 2.
Perfect. Now your vision number 2 is intact, and you have 20/20 vision. Now we're gonna do cranial nerve number 3, which is your ocular motor. And this is, I'm gonna have you follow my finger first, okay? All right. Don't move your head, just follow my finger with your eyes. Perfect. I don't see any stigmatisms. Now I'm going to shine a light in your eye. Just look directly at me, okay? All right, ready? Bright light. Perfect. Perfect. Keep looking straight at me. Perfect. So your pupils are 3 millimeters. That I just tested for part of Perla, which is the pupils are equal, round, and reactive to light. And that was for direct and indirect light. Now I'm going to, so that means your cranial nerve 3 is intact. Now I'm going to do your cranial number 4, which is your trochlear, which is the end part, the A part of that Perla, which is for accommodation, okay? So what I'm gonna have you do is I'm gonna have you look at this pen. Perfect. Cranial 4 is intact. Now we're going to do cranial number 5, which is your trigeminal nerve. So this, I'm gonna instruct you to do a couple different things, okay?
Okay.
So this cranial number 5 does 2 different things. It does your muscles of mastication. So I'm going to have you make a chewing motion for me. Perfect. And then can you open your jaw? Can you close it? Now can you do that with resistance? Perfect. This would also test for any sensations for on your face and your scalp. We would use a cotton ball, and we would do it, but it would show sharp or softness. But we're not going to do that today, okay?
Okay.
All right, now we're going to do, so your cranial number 5 is intact. Now we're going to do your cranial number 6, which is your abducens. But we already actually did that with the starburst method, which was the lateral movement side to side. So your cranial number 6 is intact already. Now we're going to do number 7, which is your facial nerve. So I'm gonna instruct you to do a couple little different movements with your mouth. Is that all right? Perfect. Go ahead and smile for me. Go ahead and frown. Can you make a chewing motion? Can you puff your cheeks out? And can you raise your eyebrows? Perfect. We would also test for your taste and salivation and your tears as well, but we're not testing those today. So with your taste, taste and saliva, we would do salt, sweet, and sour. The sour and voluntary makes you to have salivation, and the sweet and the sour test for the lower 2/3 of your tongue, okay? For your tear reflex, we would put a cotton ball, the tip of a cotton ball, into your eye to induce tears. Okay? But that means that cranial number 7 is intact. Now we're going to do cranial nerve number 8. So this is your acoustic nerve, and we're going to do that by doing what's called a whisper test. I'm going to say a 2-syllable word, and you just do what you hear. Can you cover one of your ears for me? All right, I'm going to say the word.
Baseball.
Okay, perfect. Can you do the other ear for me?
Basketball.
Perfect. This would also test for your equilibrium, which we don't really test unless it's for on your gait. So that means you're walking. So we're not testing that today. But your cranial nerve number 8 is intact. Next is cranial nerve number 9, which is your glossopharyngeal. So I am going to grab a glove. Can you say ah for me? Perfect. Say that one more time, sticking your tongue out. Perfect. All right, now I'm going to induce your gag reflex. I know this can be uncomfortable, okay? Perfect. Perfect. Cranial number 9 nerve is intact. Now I'm going to do cranial nerve number 10. This is your vagus nerve. So can you tell me your name and date of birth?
Mason, 8/12/02.
Perfect. I didn't hear any hoarseness. Could you swallow for me? Perfect. Everything is even and midline. So cranial number 10 is intact. Cranial number 11 is your spinal accessory. So can you nod up and down for me? Can you go side to side for me? Perfect. Can you do that with resistance? Go ahead. And go side to side. And then can you shrug your shoulders for me? Perfect. Cranial number 11 is intact. We're going to do our last one, which is cranial number 12, and that's your hypoglossal. I'm going to have you stick your tongue out for me straight. Perfect. And then can you move it side to side? Perfect. Cranial number 12 is intact.